Associate Professor Nigel Dixon is preparing to begin a monitoring program related to Zika virus. He's part of the New Zealand Paediatric Surveillance Unit, established in 1997 by the Ministry of Health to monitor polio symptoms. Almost 20 years on, the framework is still being utilised.
We've took advantage of the system, which is having monthly contact with paediatricians, to look for a number of other uncommon but important conditions which specialist paediatricians would see. So this is really monthly surveilling of specialist paediatricians looking for a number of uncommon but important diseases.
The unit is based out of the former Children's Pavilion building at Dunedin Hospital. The Ministry of Health funded unit is now set to be used to monitor children who may have issues due to a parent coming into contact with Zika virus.
So really what we've done with Zika that's come along onto the scene this year, we're taking the opportunity to use a system that we've had in place to ask paediatricians to report on any children with microcephaly or other obvious brain abnormalities whose mother during the pregnancy spent some time in a Zika affected area.
Zika virus has been in the news a lot lately, due in part to an epidemic in Brazil, but there have been several outbreaks in recent years, particularly in Pacific countries. It's those areas that Dixon says New Zealand mothers would be likely to have visited, but he's hopeful that the monitoring project will show a lack of abnormalities.
So I think the best news will be, and what we'd like to report back, is saying even though we've got a surveillance system in place, we have not found any children. But in a way, if you haven't got a surveillance system in place, there might be a few children out there.
The monitoring program officially begins in August, with the country's paediatricians asked to report any and all cases of children under 6 months of age with any type of brain abnormality. Ruby McAndrew, 39, Dunedin News.